unborn babies are dying. Some pregnant women dies during their delivery. And if a baby is lucky to come to this earth, he comes with deformities. What are the causes of all these problems I've just mentioned? Is it HIV, AIDS, gonorrhea, malaria, or is COVID-19? No. It is self-medication. In 2012, I was a victim of self-medication and I almost ended my precious life. I was sick as a missionary and I was supposed to inform my mission present wife. I did not. I self-medicated. My condition deteriorated in days. So when I realized that I was in a critical condition, I have to call my mission present wife. She chastised me and then she prescribed the right drugs for me. Within a twinkle of an eye, in some few days, I was well. How many people do we want to see dying before the authorities, before concerned citizens will find their voices? The rate at which self-medication is claiming lives, innocent lives of children, is very appalling. And it's about time that we do something to address this rampant social mishap. According to Pakistan Journal of Biology and Science, self-medication is defined as the treatment of self-diagnosed diseases and symptoms or continuous use of drugs for a long time. Sometimes, when we go to the hospital and they prescribe drugs for us, another time when we are sick, we go to the pharmacist and patronize these same drugs, thinking that it will solve our problem. It may even worsen our situation. According to the same source, in the UK and USA alone, about 2/6 of the population are involved in self-medication. What a pity. In the developing countries. In Ghana, about 8% of pregnant women are involved in self-medication, which is so serious. This is according to Fred Yao Abu and Jacqueline Nkrumah, 2021. How serious is this? Now, my name is Ishmael, and I'm here to tell you the reason why we should not self-medicate. The reason why we should go to the hospital when we are sick, or we should send our loved ones to the hospital when they are not feeling well. So at the end of my talk, I will expect that each of us will learn and make sure that we do not self-medicate. Now, what are the effects of self-medication on the society in general? Let me start from the pregnant woman. Now, according to Opoku R, there's a fatal death whereby unborn children dies in their mother's womb before they come to this earth. And even the mother is at risk of dying if the mother is involved in self-medication. According to Said I. Shezna in the Journal of Adolescent Health, he said that one of the most common health risk behaviors associated with adolescents is self-medication. Health complaints for which self-medication is involved. Studies have identified a strong association between self-medication and health complaints in adolescents, like headache, fever, allergies, cough, menstrual disorders, skin problems. Don't be shocked. One of the reasons why youth or adolescents engage themselves in self-medication is their parents. According to Said I. Shezna, most of the parents prescribe drugs for their kids when they are not feeling well. And as for the pregnant woman, according to Jao Gabo and Jacqueline Nkrumah, these people believe that if they take medicines on their own, it will help them in having a safer delivery, and that self-medication is less cost-effective. I understand this is true because self-medication, when implemented well, reduces the stress, the kind of stress that we put on the medical facilities. It's also cost-effective. But when it is not being used effectively, as we've mentioned, it has those adverse effects on the individual and the nation as a whole. So as a country, as a nation, as individuals in the world, what are we doing to keep this rampant social behavior that is affecting the health conditions of pregnant women, their unborn babies, and adolescents? I believe that the following may be solutions to some of them. According to Schesner, since parents are involved in prescribing drugs for these adolescents, there should be proper education on the consequences of self-medication to parents. 2, the pregnant women are also saying that there's lack of antenatal care. So I perceive that in Ghana here, there should be easy access to fertility care, and that there should be free treatment for pregnant women. Also, teachers, parents, community pharmacists, and individuals in the community should help educate the mass about this cancer, especially in the adolescent and the pregnant woman. How will you feel if your loved one just died because he could not able to seek professional health advice? I will feel sad. Imagine if you have died on mission by self-medication. What would my mission president tell my parents? What would my mission president tell my church members? It is about time that we seek for proper health care when we are sick. Remember, we are free to choose, but we are not free to choose the consequences of our actions. It is not our mandate. In the church, we are counseled that do what is right and let the consequence follow. Let us seek proper care, proper medical care when we are sick. And I believe that when we do that, the rate at which children are dying before they are even born, the rate at which adolescents are complaining of health-related issues will be reduced. Thank you.